Hello everyone, you're watching sqadia.com and today we'll be discussing meniscal injuries. Our patient is actually a 35-year-old male who happens to be a furniture worker. He has left knee pain, snapping and temporary locking sensation from past 10 days, with the right knee mildly painful and snapping sensation from past 18 months. He is an amateur football player, plays once a week, sustaining repeated injuries, admitted to emergency after sustaining rotary trauma towards right knee. Signs usually subsided after medication of 1 month. Now, if you look closely, there are two problems. On the right side, we have a chronic issue, and on the left side, we have an acute problem. In the second event, in his injury to the left knee, he was admitted after 10 days of the second injury, which, and despite medications, despite some treatment, there was actually something wrong with his left knees. Positive meniscus tests were present medially. There was no instability or decreased motion on the right knee. Left knee pain and effusion was positive, and biomechanical tests there is no pathological issue in the both knees, either in the left as well as in the right side. Now, X-ray showed no pathology. Both the knees X-ray was absolutely normal. MRI revealed medial meniscus tear in both knees. Typical finding of a bucket handle medial meniscus tear, which was present in the both knees. Was it a right diagnosis? If yes, what were the treatment options and what surgical option is available? We'll be discussing how the meniscal injuries can present acutely as well as chronically, and how to actually differentiate your case studies and your diagnosis, confirm your diagnosis, and go for the treatment of meniscal injuries.